Vaccination Implementation Guide Informational Webinar. Basically, we're just going to cover the Vaccination Implementation Event Guide that we put together under our grant from the National Council on Aging. So it's just sort of an overview, and we tried to make it really not thick and heavy and full of way too much information. Before we get started, because we've got a small but enthusiastic crowd, if you wouldn't mind introducing yourselves and seeing as how she's unmuted, Julie.
Hi, Kim. I have just joined as a volunteer with the local Raleigh Village East in North Carolina. And we do have plans. I believe before I was active with them, they did some vaccine clinics previously, but they are intending to do some again this year. And I thought I'd just jump on to hear about the implementation guidelines that you guys can provide.
Marvelous. Welcome. Lori.
Yes, I'm Lori Merrow from Valley Village in Harrisonburg, Virginia, in the Shenandoah Valley. I'm president, and I'm just curious about the ins and outs of this program.
Great.
Yeah.
Thank you for joining us.
Yes.
Sandy. Hello again.
I was on yesterday, but can never get enough information, right?
Mm-hmm.
I'm Sandy with Mount Vernon at Home in Alexandria, Virginia, Fairfax County. And this is our first vaccine clinic, and we're partnering with Safeway's mobile vaccine unit. And that this is supposed to happen October 2nd. And
I like how you said supposed to happen.
well,
It is.
we, our office is in the library, and we can't we can't reserve any of the rooms or the parking lot beyond 30 days in advance.
Gotcha.
So, and plus the head librarian's out of town until next week. And so we're assuming it's going to happen October 2nd, but
excellent. The goal. Great. Thank you.
everything's kind of in flux right now, but there's a plan with Safeway.
That's all great. That's wonderful. Priyanka.
Hey everyone, I'm Priyanka. I'm the volunteer coordinator at Pasadena Village. I couldn't make yesterday's meeting, but I watched the recording. And I just wanted to see what would be said today about the implementation guide. And we're partnering with a local, like a women's conference to do this, to do our vaccine outreach. So I just wanted to see what other people's ideas are and just kind of know more about the implementation guide. Pasadena Village has done 2 vaccine outreaches, I believe, but they were before I started working here. So I just want to absorb everything you guys say.
Wonderful. Great. Thanks for
you.
joining us. And Lucas, hello again.
Hello, hi, Lucas Livingston from Chicago Hyde Park Village, and I was here yesterday, but I certainly thought I could stand for more information specifically about the vaccine information guide. Yeah, so looking forward to it. Thanks.
Great. Thanks, Bradlin. Okay, well, Bradlin's figuring out what is going on. Bill.
I am Bill Kincaid. I'm the president of the board of the Village to Village Network, former public health officer. So I'm delighted to see so many people involved with the immunization effort.
Well, thank you all for being here. For those of you who weren't on the call yesterday and are wondering what that was about, VTVN gave out 12 grant awards to villages who applied to get some money to do a vaccination clinic. And so we had a call just for the grantees yesterday. And so that's why some of them are saying we were on the call yesterday. So for those of you on the call today who did not receive a grant from VTVN, you have not missed anything. So what I'm going to do is I've got the document up on my computer. And as we're going through, because we're such a small group, if you have any questions at any time that you just want to stick your hand up or go ahead and unmute and say, pardon me, excuse me, perfectly a-okay, because we're such a small group and I really want to make sure that you get the information that's going to be helpful to you. So I'll share my screen. Okay, here it is. It's a thing of beauty. So again, I said the implementation guide, what we really tried to do was just try to touch as many topics as we could without getting too wordy and lengthy and in-depth. So, and again, this grant is from the Administration for Community Living, which went to the National Council on Aging, which then came to us after we applied. So, purpose of the guide is basically, this is a great thing you're doing, holding a vaccination event, and thanks for jumping in and giving it a go. This is what we're going to cover in the guide. It's basically what we tried to do when we were putting this together is think, okay, start to finish, what if I have never, ever, ever put on any kind of event like this? What do I need to sort of start thinking about step by step? we probably missed a few things in here, but what we tried to do was to hit the high points to sort of say, here's some of the stuff to think about. So we're going over the getting started, some DEI information, resource planning, outreach and communication, event setup and flow, staff and volunteer training, and then after the event. Table of contents. So basically, it's interesting. So you'll start to think, okay, great, we want to do a vaccination clinic. And you might not think beyond that other than we really need to do this vaccination clinic. One thing you want to think about right at the beginning is, why are we doing this and who are we doing it for? Because when you say vaccination clinic, even though you're housed, you're a village, Julie has a question already, I see. You're muted. You're still muted, Julie?
I'm sorry to interrupt your flow.
That's fine.
Where would we get a copy of this guide?
It was sent out as a link in the Village Buzz.
Okay.
And Barbara, would you be able to send the folks one now who are on the call? Would that be okay?
Capture and I'll put it in the chat.
Terrific. Thank you. I'm sorry to interrupt.
No, please. So thinking about, again, you're a village, you serve certain populations, but think about, do we want this clinic to go beyond our folks and what other populations are around here that might be in need? So you could focus on older adults, people with disabilities, Black communities, Hispanic, Latino, sort of just thinking about what is in your area and what the need might be. This will start to sort of have you think about, okay, if we're going to be focusing on rural dwelling individuals, here's sort of how we have to go about it. It might be a bit different. Your planning might go a bit differently for rural dwelling folks than it would for people with disabilities. So you figured out, okay, we're doing a vaccine clinic, we're doing it for older adults, and we're doing it for older adults in rural areas, for example. Next thing you want to think about is, what vaccines are we going to give? And, right now, there's actually, Bill, if you wouldn't mind, Bill being a public health guy and physician, if you wouldn't mind giving a quick little update on, here's when we think the flu and here's when we think the next COVID booster will be coming out.
Let's see here.
There you are.
The boosters should be out the middle of September. The flu vaccine, I think, is probably going to be out a little bit before that, but the COVID stuff, I think, is middle of September. There is also an RSV preparation that is coming out or should be out, and I think it is, at least one of them is on the market currently. What I would do is check with the local health department if you're working with one, or with the agency that's kind of sponsoring the immunizations, because they should have more details on the availability.
Cool. Thanks, Bill.
There's a complicated network of a pecking order about who gets vaccines first, and you need to check with the people you're working with to see when they're available in your area.
Great. Cool. Thank you. I didn't realize, I knew one of the RSVs was coming, but I know there's commercials out for it, but I wasn't sure it was available yet. So great. So selecting your vaccinations, this is your clinic. So if you want to do just COVID boosters, if you want to do just COVID first shots, if you want to do COVID and flu, if you want to do COVID flu and there's a need in your area for serving unhoused people and you want to do tetanus, it really depends on who you partner with to provide your vaccinations for you. So you think about the vaccines you want. Obviously, then you're choosing the date, time, and location. We'll talk a bit more about location in a bit. And then you also want to just pick a ballpark number of, I think we can serve X number of people. So one person giving vaccinations can give between 10 and 30 an hour. That depends on your flow, how you want to set it up, how you want to get going. 15 to 20 vaccinations per hour per vaccinator is probably a better goal. And if you're doing the event for older adults, maybe adults over 80 who have mobility problems, you may want to cut back that time a little bit and have a few less appointments per hour. Draft event schedule, there's one at the end of this guide, and it's basically a very drafty, here's where we show up, here's when we set up, here's when we start the vaccines, lunchtime, that kind of thing. Get your team together. It may just be you. It may be you and a couple of other folks at this point to get going. But once you start getting your team together, you're sort of the logistics people in charge, obviously. And so that way you can just sort of say, we're going to do this many people on this day and time, and we're thinking about holding it here. Let's get rolling on this. And you can start meeting out the tasks to different folks. Diversity, equity, and inclusion. We just put some information in here about, I know that as villages that serve your members already, you are aware of a lot of the DEI issues because you are culturally appropriate and you are dignified and respectful in your communications. But we just put a little bit of information in here about different things to think about as you're going through the event planning. And the involvement of community leaders is one thing that is becoming a theme in our marketing group that's talking to different individuals to put together the outreach and communications for this, is that they're finding that people are interested in hearing from a trusted voice. So if there's a certain super senior in your community who everybody, it's like, oh yeah, we all know Jane, and yeah, she's been around forever and we trust her and whatever. A lot of times involving a community leader to be the sort of spokesperson to say, hey, I got this done, here's why I got this done, may help address some hesitancy that might be out there. Okay, resource planning, creating a timeline. I've got sort of a work plan at the end of this as well, at the end of the guide as well. And this is really, this could be all over the place because we're in the middle of August already. It's coming up. October 2nd is what, 6 weeks from now? And so even though it says, maybe you need 8 weeks to plan, you've got the time to plan that you've got the time to plan. So these are absolutely, definitely fluid timeframes, but it just sort of goes through, here's the first stuff to start to think about. So again, we've got, it could be 4 to 6 to 8 weeks to 2 months before, but you decide on the date and time, the things we just talked about, finding the venue, finding and securing a vaccine provider. We're going to talk about that a bit more, but obviously you all as the village staff or the village volunteers most likely are not going to be the ones who are giving the shots. So you absolutely need to partner with somebody in your community who can do this. Outreach and communications. in my mind, you can't advertise early enough for something just because, what is it? People need to hear something like 26 times before it sinks in. Not that you're going to send out information 26 times in a row, but even if you just send out a save the date, here's what we're thinking. That gets people thinking about, oh, cool, I don't need to figure this out myself. I can go down to this vaccination clinic that my local village is holding. With the outreach and communication, as part of this grant, I mentioned the Hannon Group. They are a PR and marketing company that we have working right now on putting together the information that you're going to need so you don't have to do it yourselves. So they are creating the messages, the flyers, the articles, and we're hoping to get that mid-September. We're hoping to get at least one piece, perhaps a news article or one flyer that we can get out before they've completed all of their work that needs to be done for the entire package. But they are creating all the stuff that you can use as a template to say, you can pop in your own village name, you can pop in your own dates and things like that. So in terms of creating all of this stuff, we've got you covered for that. We will definitely send it out and do a big email blast to let people know, here it is, it's available, have at it.
Can I ask a question?
Of course,
Sorry to interrupt you, Kim.
please.
So I thought I'd been reading everything that came down about this, but I don't recall seeing how much is the grant for, and is there an October 2nd deadline?
There is not an October 2nd deadline. The grant that VTVN received was $150,000. As part of that grant, we put in money to do sub-grants to villages to do their events. So when your village applied, your village didn't apply, did they?
No, we haven't applied. Yeah, no, because I haven't seen, I don't know why I missed it, how I missed it, but I'm sorry I missed it,
Yeah.
but so I need to ask how much these sub-grants are for. That's what I need to ask.
The sub-grant process is all done and completed, and we've announced.
Okay.
Yeah. And so, sorry about that.
So it goes.
Yes, so it goes, and because of the time frame of this, we really had to squish down the time frames and get it out. And so sorry that you guys missed it, but there may be more opportunities, and you absolutely will benefit from all of the stuff that's being done under the grant from VTVN. So you can get this implementation guide and you can get all of the resources and things like that. So hopefully that will help. Schedule, okay. 1 or 2 days before the event, obviously, you set up, you put your signs out, you walk through, you send out final reminders, emails, phone calls, whatever you decide. So rough estimate is 4 to 8 weeks of planning. For those of you who have done clinics before, how much time did you actually take as lead time to plan? Did you take 4 weeks, 8 weeks, 3 days? Were you involved in the planning? Okay. So selecting a location, and I know for those of you who have held clinics before, you know where you're going to have them. And Sandy, you're having yours at the library, it sounds like, with the mobile clinic. So for those of you who haven't done them before or are looking for different locations, the main thing for holding an event for older adults, one of the main things is a familiar place to go to. So folks don't necessarily want the event to be in a place that they've never heard of, or it's just not accessible. Something that's really familiar, the senior center that everybody knows, the Bob's Diner down the road that every single person knows about in the community, libraries, churches, other places of worship, something that is familiar to the community. As accessible as possible, because you're probably going to have folks with limited mobility and different things like that. And let's see, capacity, of course, it'll give you, depending on how many people you want and the area that you need, depending on the different areas, you can look at community centers, senior centers, colleges, schools, universities, hospitals, churches, hotel conference centers, whatever works for your community. And another thing is, and if you were talking to my brother, who is absolutely obsessed about making sure there's a parking spot, the absolute number one thing when I say, Mark, let's go do this, he'll be, well, where should I park? And so looking for a place that has lots of parking, or you can say there is absolutely right across the street from the library is this where you can park. That is a good start. Accessible, the amount of space that you need, bathrooms, good lighting. A lot of people really don't often think about good lighting. The older adult eye needs like 3 times more the amount of light than we do to see the same stuff. And privacy and confidentiality. Sometimes your space isn't going to allow that just because it's the space you could get and you're using stand-up screen dividers instead of having things in separate rooms. But you try to, as much as possible, have the private areas for the private conversations or talking about different health conditions. If possible, Wi-Fi and tech support and kitchen facilities. Not necessary, but somebody yesterday said if you have food, people will show up. So, any comments about anything so far? Okay. Partnering with a vaccination provider. Again, you're going to need to do this. So depending on where you are, the local regulations, who is allowed to go out into the community to do this. Some of you already have a mobile clinic already on board, so that's fantastic. Pharmacy chains and independent pharmacies are probably the place where you want to start. You know, through COVID, they were most likely the ones who were holding vaccination clinics, have availability to the vaccine. And a lot of independent pharmacies in smaller communities, the folks who live there are familiar with them because they've used them for years and they trust that, you know, the Blue Ridge Pharmacy is going to do a good job for us. Hospitals or healthcare systems, community health centers, mobile vaccination units. As Bill said, check with your local health authorities to see if they're not able to help. Maybe they can say, oh, we've had some good luck hearing about this pharmacy or this hospital satellite clinic will help. Pre-registration and appointment setting. This is interesting. I talked to a few different villages who have done vaccination clinics just to get different ideas to make sure we're covering everything in this. And as much as we were talking about create an online registration portal if you can, or do a spreadsheet, or you know, and make sure that you've got every 10 minutes somebody coming in. And this one village said, yeah, we didn't set appointments. We just said to the first 30 people that signed up, come in between 10 and 12. And to the next 30 people that signed up, we said, come in between 1 and 3. And they said they had absolutely zero problem with everyone showing up at the same time, things backing up. So I just found that really interesting because you often hear, you know, I need to know what time I need to be there, when should I show up? But they had great success with saying, we're going to serve 30 people in this time and 30 people in this time frame. Depending on your community and the population, you can either, you know, do registration over the phone. There's some online booking easy registration portals for things. There's something called Acuity Scheduling, which I think I used to use, and it was like $5 a month, but it allows people to go in and pick their own times as well. And then if somebody calls you, you can go in and cover that time over. But whatever works best for you, it could be an Excel spreadsheet that you've printed up and you just sign people in that way. Timing of appointments, again, this really depends. Some folks said for fixed time slots, we had one person every 5 minutes. Some said 2 people every 10 minutes, which gives a bit more flexibility of, you know, if 2 people show up every 10 minutes and they show up right at that time, that gives you another 10 minutes for hopefully then the next will show up. 5 people for 15 minutes. You can try the, you know, 30 people in 2 hours, whatever you think is going to work. And if when you start the event and it doesn't seem to be working, that's fine, because you pick the best thing that you could, thinking this is what's going to work, and you just figure it out and go with it. I personally think that setting scheduled times would work. I just can't see in my organized brain how saying 30 people arrive between 10 and noon, because I just have a vision of everybody showing up at the same time. But again, it worked for them. So, and you'll also need to decide, are you going to allow walk-in appointments where people are like, I didn't get a chance to sign up and I just came in now. It might be helpful to build in every now and then in your registration schedule a blank 15 minutes where nothing is happening and nobody's showing up, so that you can catch up if you're a bit behind with the people you've got. And if anybody does walk in, then you might be able to get them in there. Outreach and communication. Again, this is all going to be covered by the Hannon Group information and materials that they're putting together for us. That will also, they're also creating them in Spanish. So for those of you near Hispanic or Latino communities, it'll be available in Spanish as well. And it talks, they're doing all this market research right now for specific targeting for older adults. And they also will be providing information on, they'll have social media posts, they will have different ideas of contact this type of media if you're trying to reach this type of person. So they're getting very targeted and very specific, which I think is interesting. And they also said, due to the toxic nature of online discussions about COVID-19 vaccination on social media sites, they strongly recommend leading social media messages with flu information rather than COVID to help offset the pushback, but you just never know. And some of you might not do a lot of social media, so yes, hopefully that information from them will be available by the second week of September. Any comments, questions? Okay, preparing the space. The way I think about sort of the vaccination clinic is think about it sort of like an assembly line, where there's always, you've got different stations and there's always going to be people at each station. So your first two people come in to get registered, they move on to the waiting area. You've got two more people getting registered, the people in the waiting area then move on to getting the vaccination. And it's just this flow of station to station to station. If possible, put signs outside, clearly mark, put more signs than you think you're going to need. You know, for those of us who are somewhat directionally challenged and are absolutely convinced they know where they're going, but they don't, as many arrows as you can put is as helpful as can be. If you have a lot of volunteers and you want to stick somebody out by the front door in the parking lot, you know, waving a flag, whatever works for your area and the resources you have. Try to have your registration area as close to the front door as possible. We're sort of looking at how you can streamline this for folks, and especially if there's individuals with limited mobility and or limited cognition, it's helpful to sort of have everything right when you get in there. So you're going to need area for check-in. You may want to have in between the check-in and the vaccination areas a sort of waiting area where if it does start to get backed up, you've got folks that are registering and then you can sit some people down in this waiting area while the vaccination stations are moving people through. So you might want to just stick a few chairs or have sort of a little separate area for that. The great thing about the vaccination stations and the paperwork and everything that you're going to need, your vaccine provider is going to tell you all of that. So you don't need to figure out how to set up the vaccine stations. They will say to you, you know what, here's what we need. We're going to need 2 tables per station. We're going to need a chair. We're going to need 3 clipboards. They will tell you exactly what they need. And so don't worry about trying to figure out from that perspective. I called this the post-vaccine lounge, but it's basically, I don't think there needs to be officially health-wise, what am I trying to say? Watching the person for 15 minutes after they have the vaccination. I don't think that's a necessity, but some villages have said that, you know, last year when we did this, we sort of had a space, but not really, but people just hung out and they wanted to talk and they wanted so we were running around getting coffee for people and whatever. So we put this in to sort of have a communal, let's just hang out and see if, people start chit-chatting and just have a sort of social, bit of social engagement as they're hanging out after their vaccination. Any thoughts on that? One thing that I think is going to be really helpful too is, I don't think this is in the guide, but once you have all your spaces set up, grab yourself a cane. If you don't use this one, just grab a cane and work your way through to see if you, or a wheelchair, and see if you have enough space to get through all of the different areas that you need to get to. Or if, if I'm using a wheelchair and I can't roll up underneath the table to fill the forms out, have you got enough clipboards? That sort of thing. I'm a huge fan of the walkthrough and the walkthrough again, and take people with you and take your volunteers with you, because they'll notice things that you might not notice, that they can say, well, how about we put this chair over here because of this reason? So I love the walkthrough. Volunteers, you obviously cannot do this alone because you've got all these different stations. So these are just some of the positions. Again, it depends on your resources, how many folks you have, how many folks you can get a hold of to help out. People to greet as the person comes in. People to do the paperwork. If you don't have enough for greeters and paperwork people, those, you can combine some of these positions, and the greeter can also be the person who's helping them fill out the paperwork. Ushers, sort of as helping move people from one spot to another, so they kind of float all over the place saying, okay, great, you filled out your paperwork. It looks like vaccination station 1 is open. Let's go over there. A supply assistant, I look at this as sort of the running around, making sure everybody has the stuff they need. So perhaps they need one more clipboard here, and this they need extra pens over here, and the garbage needs to be emptied here. So having somebody who's sort of the restocker looking around to make sure everything's ready to go. Post-vaccination lounge, I think it would be great to have somebody hanging out there to be able to say, hey, great, how's it going? Do you want a coffee? Do you want a pop? I'm from the north. Here's some snacks. And also, if you're going to be doing any surveys or getting any feedback from folks, this might be a good place to have a volunteer to say, oh, great, well, if you don't mind, we have this voluntary survey for you to fill out, and here it is if you'd like it. Depending on the area you're in and the availability, if you think there's going to be folks showing up with English as their second language, then maybe think about having some language interpreters around. Feedback collectors could be the same person as the one who's in charge of the post lounge area. And then if you have enough, you can have a floater who's just basically floating around, and the one who is like, oh, I noticed out here that this has happened, I'll go get somebody to do this. Again, depends on how many people you have, how long of a shift you want them for, all that kind of good stuff. If you want, you could ask your volunteers to wear a certain color shirt so they sort of stand out from the crowd so that people know, or if you're trying to say, go ask so-and-so, you can say, go ask that person over there in the red shirt. I think it's also would be a nice idea to have the lead person in charge. So whether it's, one of you or somebody else in your village who is the, top of the heap for being in charge, if they could wear a certain scarf or a hat or something, or a pin or whatever that makes them stand out, so that if media shows up, you can say, go find the person who's holding the pinwheel. Or if something goes wrong and they need to be identified immediately, they're wearing something that can make them stand out a little bit, and your volunteers will all know that. Scheduling, folks, again, this is depending on your volunteers, which you probably know pretty well by this point. Do they want to work the whole day? Do they want 2 hours? Do they want 4 hours? Do they want to do, I found that once folks get into a certain volunteer position, they don't want to do something else. So they want to stick with what they've been assigned to. And you can ask them beforehand, here's what we have available. Here's the time slots we have available. What do you think you might want to do? And sometimes people say, well, I don't know, because I'm not sure what what I'd be good at. And you sort of get a feel for the volunteers you have that are really gregarious and engaging can be the front people who are the greeters and the signers in. And the ones who are really good with noticing things and logistics could be, you could suggest, well, I know you're really good at this. How about you try this position? You know, shorter shifts might be easier to fill than long ones. It depends on the length of your event as well. If you can have slightly overlapping shifts where I'm available to help from 10 until 11:30, and then somebody else taking over for me shows up at 11:15 to go to work the next hour and a half shift. So that way I can be like, oh, this is a really cool position. Here's what you need to know. Here's your stuff. Here's what's going to happen. Here's what you're responsible for. Volunteer breaks. Sometimes the floater person can be the, I'll fill in for you if you need a break. Training session, I think for training your volunteers, again, it's going to depend on what you're used to doing with your volunteers. You can do it online ahead of time. You can just, you know, get everybody together on a online meeting and say, great, thanks for volunteering. We're going to talk through, this is what the different positions are. This is what we'd like you to do. I think it's really, really, really important, if possible, to get people there the day before. Your volunteers, get them the day before when you've got everything set up so they can see, okay, here's my 3 volunteers in the day who are going to be helping out at the vaccination stations. So they can look around, get a feel for it, and maybe sort of make it their own so they know this is what I'm going to be doing and this is my area. And again, doing that walkthrough with as many people as possible can help you notice or help them notice, oh, it doesn't look like this is going to work because of this. Let's move this screen over this way. Love the hands-on practice. If you want to get all your volunteers set up in their respective spaces and you want to be the guinea pig of pretend I'm somebody coming in and you're signing me up, let's go through this step by step. That hands-on stuff can be really helpful as well. Just a few simple checklists at the end here. And of course, you can add stuff on. But these are just some ideas to start thinking about the different things we might need. And of course, you can add on as much as you want. Short little checklist of the different things you need to do that we talked about before of 4 to 6 weeks, 2 to 3, week of, day of, that sort of thing. Very brief example of your agenda, just so that in general, you know what's going on. And then this work plan we tossed in here, just if you are a visual person and you want to do the, okay, major objective is to create and sign people up. And Kim is in charge, and we're going to start that week 3, because in week 1 and 2, we're going to be doing contacting. And so this is just, if you're interested, you just block out and say, okay, in week 1, here's the 4 things here and here that we need to be doing, but we don't need to do this until week 5. So it just kind of gives you a nice visual if you're that sort of person. And that is it. What do you think? Did we miss anything? Do you have any comments, thoughts, questions? Was that helpful to sort of see it in that step by step?
Yes.
Great. Well, if there's no questions or comments, Sandy.
Yeah, well, so I was a little nervous at first about having the vaccine clinic, because I talked to someone who has volunteered, you know, with a clinic before, and she was saying you have to have, you know, emergency equipment and other, but then I realized that the vaccine clinic provides all that necessary.
I imagine, yeah, exactly. And also if you're in a senior center, or a lot of public buildings already have the defibrillator and the,
Right.
yeah, and so that's a good point there.
That makes it a lot easier,
Yeah.
a lot less stressful. But
Yeah,
that was very
yeah.
comprehensive. Yeah.
Great, great.
Thank you.
All right. Well, if
Yeah,
there's
hi. Oh, sorry. Yeah, it's Lucas Livingston. Just wanted to share. I think it's a great document, and I think it just can serve for so many other events, even unrelated to vaccinations. I think it's just a great example of how to run a successful program, an accessible program. So yeah, thanks for producing this.
Oh, well, thanks for that comment. Maybe we'll take it and make it more generic and give it back out to villages saying, hey, this is a generic for running an event. Contact me at any time if you have any questions. Thank you all so much for being part of this. And seriously, if you have any questions about how to, we're thinking about doing this, but we can't quite figure it out, just get in touch. And for your grantees out there, we will be in touch. Well, thank you all.
Bye-bye.
Bye-bye.
Thank you.
That was fun.
Very good.